Did you know diabetes mellitus is the most common cause of blindness in young people in North America? That's right, let's unpack this a bit more. Diabetes mellitus, often simply referred to as diabetes, is a chronic condition characterized by high levels of sugar in the blood. It occurs when the body fails to produce enough insulin or cannot use it effectively. Now, you might be wondering, what does this have to do with vision? A lot, actually. Diabetes can cause various complications, and the eye is one of the organs that can be significantly affected. The high blood sugar levels caused by diabetes can damage the small blood vessels in the retina, the light-sensitive part at the back of the eye. This condition is known as diabetic retinopathy, and it's a leading cause of blindness in adults, but that's not all. Diabetes can also lead to other eye problems like cataracts, where the eye's clear lens becomes cloudy, or glaucoma, an increase in fluid pressure inside the eye that can lead to optic nerve damage and loss of vision. Sometimes diabetes can cause the muscles that control eye movement to become paralyzed or weak, a condition known as extraocular muscle palsy. Moreover, diabetes can cause a sudden change in refractive error, meaning that your ability to focus might be affected. This is because high blood sugar levels can cause the lens in the eye to swell, changing your ability to see. So if you or someone you know has unexplained retinopathy, cataract, extraocular muscle palsy, optic neuropathy, or a sudden change in refractive error, it's crucial to consider diabetes as a potential cause. Now that we have established the connection between diabetes mellitus and vision loss, let's delve deeper into why this happens. In our next segment, we'll explore the background of diabetic retinopathy, its stages, and how it can lead to vision loss, so stay tuned. So how exactly does diabetes mellitus lead to vision loss? A key player in this scenario is diabetic retinopathy, or DR for short. This condition is the result of blood vessel damage in the retina due to high blood sugar levels. It's the most common cause of vision loss in people with diabetes, and it's also the leading cause of blindness in adults. DR develops as a result of altered vascular permeability. This involves the loss of pericytes, which are cells that wrap around the endothelial cells of capillaries and venules in the retina. There's also a breakdown of the blood-retinal barrier and thickening of the basement membrane, which is a layer of the retina that separates it from underlying blood vessels. In addition, there's a predisposition to retinal vessel obstruction, which can lead to conditions like central retinal artery occlusion, central retinal vein occlusion, and branch retinal vein occlusion. Diabetic retinopathy can be classified into two main types: nonproliferative and advanced nonproliferative. In nonproliferative DR, there's increased vascular permeability and retinal ischemia. This can lead to microaneurysms, dot and blot hemorrhages, hard exudates, which are lipid deposits, and macular edema, which is swelling in the macula, the part of the eye responsible for sharp central vision. In advanced non-proliferative DR or preproliferative DR, you'll find non-proliferative findings plus venous beading in at least half of the retinal quadrants. There are also intra-retinal microvascular anomalies, which are dilated, leaky vessels within the retina in a quarter of retinal quadrants. Plus there are cotton wool spots, which are nerve fiber layer infarcts, or areas of tissue that have been damaged due to lack of blood supply. As we can see, diabetic retinopathy is a major concern when it comes to vision loss in diabetics. It's a complex condition that involves a number of factors, from blood vessel damage to changes in the retina. And the more advanced the DR, the greater the risk of vision loss. So understanding this condition is crucial in managing diabetes and preserving vision. We have now understood the initial stages of diabetic retinopathy, but what happens when it progresses? The proliferative stage of diabetic retinopathy, while affecting only a small fraction of patients with diabetes, about 5%, poses a significant threat to vision. In this stage, new blood vessels begin to grow or proliferate on the surface of the retina and into the vitreous, the gel-like substance that fills the eye. These new vessels, however, are not as robust as they should be. They are fragile and can bleed easily, leading to a vitreous hemorrhage. This hemorrhage can cause a sudden and severe loss of vision, as the bleeding prevents light from reaching the retina. Additionally, the growth of these new vessels can lead to scar tissue formation. This scar tissue can shrink over time, causing a tractional retinal detachment. This detachment can further lead to severe vision loss or even blindness. One of the complications that can arise in this stage is neovascular glaucoma. This occurs when the new blood vessels interfere with the normal flow of fluid out of the eye, causing pressure in the eye to build up. This increased pressure can damage the optic nerve, leading to vision loss. Another complication is the neovascularization of the iris, also known as rubeosis iridis. This can lead to the development of neovascular glaucoma, which has a poor prognosis. However, it's not all doom and gloom. Although the proliferative stage of diabetic retinopathy can be dangerous, early detection and treatment can significantly reduce the risk of vision loss. Regular eye screenings are crucial, especially for those with a long history of diabetes. The proliferative stage of diabetic retinopathy is indeed dangerous, but with early detection and treatment, the risks can be minimized. So, let's move on to the screening guidelines for diabetic retinopathy, which can help in the early detection and management of this condition. Early detection is key in managing diabetic retinopathy, but how often should one get screened? Let's delve into the screening guidelines for diabetic retinopathy, a complication of diabetes mellitus that can lead to vision loss if not managed appropriately. These guidelines vary slightly depending on the type of diabetes and specific circumstances such as pregnancy. For individuals with type 1 diabetes, screening for retinopathy should commence annually 5 years after disease onset. This means that once a person has been diagnosed with type 1 diabetes, they should start getting their eyes checked for signs of diabetic retinopathy 5 years later. This annual screening is especially critical for all patients over 12 years old and those entering puberty. In the case of type 2 diabetes, the screening process should begin immediately. An initial examination should be conducted at the time of diagnosis, followed by annual screenings thereafter. This approach is crucial because type 2 diabetes often goes undiagnosed for years, and eye problems could already be present at the time of diagnosis. Pregnancy presents a unique situation. An ocular exam in the first trimester is recommended for pregnant women with diabetes, followed by close monitoring throughout the pregnancy. This is because pregnancy can exacerbate diabetic retinopathy. However, it's essential to note that gestational diabetes, a form of diabetes that arises during pregnancy, does not increase the risk for diabetic retinopathy. Regular screening plays a pivotal role in identifying and managing diabetic retinopathy early. Early detection can lead to timely treatment, potentially preventing severe vision loss. It's also important to remember that while these are the recommended guidelines, your healthcare provider may suggest more frequent screenings based on your specific circumstances and overall health status. So, in essence, if you or a loved one has diabetes, ensure regular eye examinations are part of your healthcare routine. Regular screening can make a significant difference in managing diabetic retinopathy. Now that we know the importance of screening, let's talk about the treatment options available for diabetic retinopathy. One of the most important steps in treating diabetic retinopathy is to maintain tight control of blood sugar levels. This can significantly decrease the frequency and severity of microvascular complications, as demonstrated by the Diabetic Control and Complications trial. Apart from this, blood pressure control is also crucial in managing this condition. In terms of specific treatments, focal laser therapy can be used for clinically significant macular edema. This procedure, along with the intravitreal injection of corticosteroids or anti-VEGF, can be particularly helpful for foveal-involved diabetic macular edema. Another laser treatment, known as panretinal laser photocoagulation, is effective for proliferative diabetic retinopathy. It works by reducing neovascularization and thus decreasing the angiogenic stimulus from the ischemic retina. This in turn reduces retinal metabolic demand and lowers the risk of blindness. In some cases, a vitrectomy might be required. This is a surgical procedure that removes the vitreous from the eye. It's used for non-clearing vitreous hemorrhage and retinal detachment in proliferative diabetic retinopathy. However, it's important to note that performing a vitrectomy before vitreous hemorrhage does not improve the visual prognosis. Remember, early detection and treatment are your best defense against diabetic retinopathy. Lastly, let's discuss how diabetes mellitus can also lead to changes in the lens of our eyes. A common change that can occur in individuals with this condition is an earlier onset of a condition known as senile nuclear sclerosis, which is a type of cataract. It's a gradual, painless clouding of the lens, which can ultimately lead to a decrease in vision. However, don't lose hope. Managing your diabetes effectively can help prevent these lens changes and preserve your vision. We have covered a lot today, from understanding diabetes mellitus to its impact on vision and how to manage it. We explored the background of diabetic retinopathy, its different stages, and the importance of regular screenings. We also discussed various treatment options and the lens changes that occur in this condition. Stay informed, stay healthy. Please subscribe for more informative videos like this one. Give us a thumbs up if you found this video helpful. Thank you for watching.